is that you can transition it. In other words, you put it on as a full brace initially to fully support and align that spine and hopefully eliminate that problem. But as you get better, as you go to therapy, as you go back to see the doctor, the physical therapist gives you some exercises and all those kinds of things, and you're feeling much, much better. You can take this panel off. Take this panel off and put it in the closet. And they can wear this as a belt. And still has plastic back here, which will give them some support. Also, you can take the anterior panel off as well and put it with it, and still have what we call a lumbosacral support. And it still has rigidity to it, especially in the back. So you can transition this down from a full, what we call 631 back brace, down to what we call a 626, which is basically no panels. The panels give it rigidity and more support. So, in donning this, we say you open the right side, and then you let it fall, and then you reach around. This is here again, patient support or spousal support is real important, because if you've got a spouse there or a family member or someone that can help you, actually take the back panel and place it exactly between the shoulder blades the way it should be. That makes it a lot easier. If you don't, there's different ways. They can do it in a chair. They can lay this in a chair, like so. They can sit this right there in the middle of that chair and have them sit down. That's an easy way to get it, and that way they don't have to try to, if they're having a lot of pain, you don't want them, doing this. So anyway, I tell them to place that panel on their back. Once they get that in the back, and you can feel here again family support, whether it's aligned or not. Does it look like it's aligned on me? It's probably a little short to me because I'm tall, of course, and we do have tall models that they can get if it doesn't go up to the shoulder blades. And I'm not saying all the way to the top of the shoulder blades, just in that general area, because we're all different as far as heights and weights and those kind of things. So once you get that to where you feel like it's aligned, the next thing you need to align, of course, is the anterior panel. You don't want the anterior panel over here. You want it in the middle. And if it's not quite in the middle, okay, I'm going to play like it's over here. Then what I do is I take this off and just move it back some. And then I move this over. Okay, support. I want to be sure you see this. To make sure that anterior panel is in the middle of the abdomen. And then you fasten that. And all you want at this point is to be snug. Snug. Okay, that feels kind of snug. Once you feel it snug, then you take the two pull tabs, pull them out, and then forward. I mean, it really is. It is strong, very strong. And I have big thumbs too, by the way. But these are, for your thumb. And once you get that on and snug, you say, wow, boy, that feels good.